This is Jonathan Fite, co-founder and chief executive of Beyond Lucid Technologies, a consultant with the Brain Trust of Fire and EMS technologists, and one of some 400 participants passionate about our industry who come together as part of the Congress of Mobile Medical Professionals, an organization that's grassroots, that's come from the bottom up during and formed in the midst of a public health crisis, with a commitment to addressing some of the most pressing concerns to all aspects of our industry. No matter the patch color, no matter the payment model, no matter the region, there are some issues that concern us all. And this Thursday, I'm going to have the privilege of talking about ET3, this new amorphous, still changing, future-focused model of care that is supposed to be value-oriented, that is supposed to put mobile medicine on an even playing field with the rest of the healthcare ecosystem. Will it do that? What questions still remain? Why is there this concept known as ET3? A tiptoe by federal authorities toward the concept of community paramedicine at a federal level. So basically treating the patient at their side and not having to transport them, having a value-based approach to doing mobile medical clinical work and still getting paid for it without transport. The second is that our industry deserves a raise, period. There needed to be a structure and a reason for the feds to authorize a raise through CMS. So the creation of a new pilot structure to determine whether they'll get enough data to justify doing so is really a main objective of ET3. And the third is telemedicine. Not just in the context of COVID, but COVID presented a wonderful catalyst and occasion to make telemedicine a thing. There's been a lot of focus and a lot of money pumped into telemedicine, and mobile medical professionals have largely been left out of that. There are some real concerns around infrastructure. Do you have the ability in rural environments to even get enough of a signal to participate in telemedical models? And what happens if you don't? Do you still get paid, even if the network is down, even if you're in a dead zone, if you're in a basement, if you're under a bridge? By the way, little secret, the ambulance cost accounting exercise that came out just around the same time as ET3, if anybody thinks that's an accident, maybe not so much. We're going to talk about all of these trends on Thursday and possibly throw out some questions that are still unanswered. Congress of Mobile Medical Professionals meeting every other Thursday. We look forward to your participation. United in Service.